Dear students, welcome back. In the previous session, we have seen the introduction of the abdomen, and now we are going to see the osteology of the abdomen. In this abdomen, various bones which are related to abdomen are: one is the lumbar vertebrae, sacrum, and the bony pelvis. Okay, and also some part of lower ribs and costal cartilage are also closely related to the abdominal wall. So these ribs and costal cartilages we have already studied in the thorax region. Okay, now coming to the lumbar vertebrae. So here is the lumbar vertebrae. So one is the superior view and the lateral view. There are 5 lumbar vertebrae are present, of which 1 to 4 is typical lumbar vertebrae. This one is the typical lumbar vertebrae. So from 1 to 4 of lumbar vertebrae are called as typical lumbar vertebrae. Okay, and the 5th one is called as atypical lumbar vertebrae. And how can you identify this lumbar vertebrae? This can be identified by its large size and the absence of costal facets on the transverse processes or on the body also. That is the absence of costal facets on the body also. And also absence of foramen in the transverse process also. So what are the distinguished features of the lumbar vertebrae with the other vertebrae which are present in other regions, that is cervical and thoracic region, are: here the vertebrae is large in size and the absence of costal facets on the bodies, as well as the transverse processes, and also absence of foramen in transverse process. The foramens which are present in the transverse processes are seen in cervical vertebra, and it is not seen in thoracic vertebra and also the lumbar vertebra. And the costal facets which are present on the body and the transverse process are seen in the thoracic region, but those facets are also not present in the cervical region also, and also the lumbar region. So in the lumbar region, the distinguishing features of cervical as well as the thoracic vertebrae is not seen in the lumbar vertebrae. Okay, so simply the lumbar vertebrae can be identified by its large size, absence of costal facets on the body, and the absence of foramen in transverse processes. So these are the identification features of the lumbar vertebrae. Now coming to this typical lumbar vertebrae, first we will see the parts of the lumbar vertebrae. So this one is anterior and this one is posterior. So here anterior and posterior, superior and inferior. Okay, so this is the superior aspect of the lumbar vertebrae. So anteriorly it is having the body. This one is body. Okay, and here you can see the upper portions, you can see the pedicles. So here you can see this one is the pedicle here, and then it is giving some processes, isn't it? So that one is the transverse processes, and it gives the laminae forming the neural arch, and these two laminae is forming the spine. Okay, and here the distinguishing features, and also it is having this transverse process is having some accessory processes. Some extra processes is present in the lumbar vertebrae, that is the accessory processes are present. And over this, it is having the superior articular process. Here you can see the superior articular process, and by the side of its superior articular process, an additional process which is seen only in the lumbar vertebrae is the mammillary processes. Mammillary processes. And so all these can be seen on the superior aspect. From the lateral aspect, you can see the inferior articular processes here. Okay, and also inferior vertebral notch. Okay, and also this one is the superior vertebral. Above this one forms the superior vertebral notch. So these notches of adjacent vertebrae unite to form the intervertebral foramens. Okay, so these are the parts of the vertebrae, lumbar vertebrae, and now we are going to discuss each part of this lumbar vertebrae. So this one is the typical lumbar vertebrae. The typical lumbar vertebrae is present from 1 to 4 of 5 lumbar vertebrae, and the 5th lumbar vertebrae is called as atypical lumbar vertebrae. Okay, now we will see the first part, that is body, which is present on the anterior aspect of the vertebrae. So the body is large and it is wider from side to side. So this body is large and it is wider from side to side, and the height of the body is slightly greater in the anterior aspect than the posterior. Because of the difference of this height, it contributes the forward convexity of the lumbar vertebrae. So if you can see, so because of this increase in size, so it is increasing the anterior convexity of the lumbar vertebrae. Okay, so which helps in the forward convexity or anterior convexity of the lumbar spine. So that means it has to bend backward. Okay, like it has to tilt. The body is going to tilt like this. So for that reason, this anterior portion of the body is slightly greater than the posterior portion of the body. Okay, now, so this is about the body. Now coming to the vertebral foramen, next one is the vertebral foramen. So the vertebral foramen, in the case of lumbar vertebrae, which is in triangular in shape. So if you can see, this vertebral foramen is in triangular in shape, and it is larger than in the thoracic region. So the vertebral foramen is larger than the thoracic region, and the vertebral foramen is smaller than the cervical region. So why it is larger in the cervical region? Because the maximum size of the spinal cord is present at the cervical region, and in the lumbar region, at the level of L1 or the upper part of the L2, the spinal cord is going to be end up, and also the spinal nerves which are emerging out of these vertebral foramen decreases the size of the spinal cord as a whole. Okay, when you come to the lower vertebra, so why it is increased means, here it forms the cauda equina, where the number of nerves which are supplying to the lower part of the body, so or coming in the lower vertebrae. So for that it has to accumulate those bunches of nerves. So for that reason the vertebral foramen in the lumbar region is larger than the thoracic region. In the thoracic region such kind of nerves cannot be seen because each intervertebral foramen is giving each pair of spinal nerves. Okay, so this is about the vertebral foramen. Coming to the pedicles, here the pedicles are short and strong. So the pedicles are short and strong. They project backwards from the upper part of the body so that the inferior vertebral notches are much more deeper than the superior. So because of this, pedicles which are present on the upper part of the body only, so which causes the increase in depth of the inferior vertebral notch. So just imagine if the pedicle is also present at this level, so there is no that much deep for this vertebral notch. For that reason, so the body is the pedicle is originating from the upper part of the body only. Okay, now the next part is the laminae. The laminae are short and thick and broad. So this is the laminae, which is short and thick. So these are short and thick and also broad. So they are directed backwards and medially. So they are directed backwards and medially to complete the vertebral foramen posteriorly. So this is the thing. So this forms backward and posteriorly. So it completes the vertebral foramen backwards. The overlapping between the laminae of the adjacent vertebrae is minimal here. Okay, so that means the laminae of the above or below vertebrae is very minimal. If you can see the spine forms a vertical quadrilateral plate directed almost backwards. So which is present like this, vertical quadrilateral plate on the posterior aspect. Okay, directed almost backward. If you can see here, it is directed almost backward and somewhat slightly downwards. It is thickened along its posterior and inferior borders, which is thickened at the posterior and inferior borders. Okay, so this is about the spine. Now coming to the transverse processes here. The transverse processes, so this is the transverse process. The transverse processes are thin and tapering and directed laterally and slightly backward. So these are thin. The transverse processes are thin and tapering. That means somewhat flattened type. Okay, tapering and directed laterally and slightly backwards. So this one is directed laterally and slightly backwards. Okay, these develop from the costal element and are homologous with the ribs in the thoracic region. Okay, so normally in the thoracic region So some of the facet, the ribs are getting attached to it. So at that region, these transverse processes are very much related to the thoracic region. Now coming to the posterior inferior aspect of the root of each transverse processes. What is the area? The posterior inferior aspect of the root of each transverse processes of the vertebra is having a small rough elevation called the accessory processes, which represents the true transverse process of the vertebra, as these develop from the transverse element of the vertebra. So this is the accessory processes of the vertebra. Okay. Where it is exactly located? Posterior inferior aspect of the root of each transverse processes. Okay, the length of the transverse processes increases from L1 to L3 and it is decreases further. Okay, from L1 to L3 the transverse process is going to increase. After that the transverse process is going to decrease. Okay. Now coming to the superior articular processes, which is lie further apart than the inferior. So if you can see this superior articular facets, so here you can see the superior articular facets which lie apart from each other. Each process bears a concave facet. So here this is the concave facet which is facing medially and backwards. So the facet is facing medially and backwards. The posterior border is marked by a rough elevation called as mammillary process. So here you can see the thickened part which is called as mammillary processes. So this one is the mammillary processes. So this is about the superior articular process. So the superior articular processes are farther apart than when you compare to the inferior one, and each processes bears a concave facet facing medially and backwards. The posterior border is marked by rough elevation called as mammillary processes. Coming to the inferior articular processes, the inferior articular processes we can see in the lateral aspect here. So the inferior articular processes lie nearer to each other than the superior. So you can see the superior articular facets are far away from each other, but whereas the inferior articular faces, which are almost all present very nearer. So I am showing here on the superior aspect. So you have to imagine that this inferior articular processes which are nearer to each other than the superior. So these are all about the features of the typical lumbar vertebrae. Now we are going to see the atypical lumbar vertebrae, that is the fifth lumbar vertebrae. Here you can see this one is the fifth lumbar vertebrae. So this is the fifth lumbar vertebrae here. The fifth lumbar vertebrae can show some of the distinguished features with that of the typical vertebrae. Now we are going to see only the distinguished features. So here if you can see the first one, we can see the transverse process. Here this is the transverse processes which are thick, short and pyramidal in shape. So this one is in the transverse process is in pyramidal in shape, and their base is attached to the whole thickness. Their base is attached to the whole thickness of the pedicle and encroaches on the side of the body. So here we can't see the pedicle exactly. So normally in other typical vertebrae, so pedicles are coming like this, and then which is giving processes, that is transverse processes, okay, and then it is forming the laminae. So here such kind of differentiation is not seen. So this transverse processes, which are thick, short and pyramidal in shape, their base is attached to the whole thickness of the pedicle. So the base is attached to the whole thickness of the pedicle. It is attached entirely with the pedicle, okay, and also encroaches on the side of the body. That means it is also extending towards the body also. The transverse process is also extending towards the body of the lumbar vertebrae. Okay, this is one of the distinguished feature. And another distinguished feature is the inferior articular process. So here normally in the the remaining lumbar vertebrae, the inferior articular process are very much nearer when compared to the superior articular surface, isn't it? Yes. Here in this fifth one, this is the another distinguished feature, that the inferior articular processes is equal or more than the distance between the superior articular processes. It may be almost equal for the superior, so that means for the superior articulating surface it is almost equal, or sometimes it is more than the distance between the superior articular processes. Okay, and coming to the spine, here the spine is small, short and rounded at the tip. Here you can see where the spine is quadrilateral, isn't it, in shape, forming a quadrilateral plate. But here the spine is small, short and rounded, small and short, and it is rounded at its tip. Okay, this is the important distinguishing features with that of the typical lumbar vertebrae. Okay, now coming to the other features of the fifth lumbar vertebrae are the body is the largest of all the lumbar vertebrae. Here the body is largest of all the lumbar vertebrae, and its anterior surface is much extensive than the posterior surface. So it is almost or very much greater in height when compared to the posterior surface. Okay, and this difference is responsible for the creation of the lumbosacral angle, and that angle is 120 degrees in an adult. So because of this extensive anterior surface than the posterior surface, it is forming a lumbosacral angle. So this one is the lumbar region, and here it is forming the sacrum here. With the sacrum it is forming an angle here. So this angle is called as lumbosacral angle. This lumbosacral angle is due to the variation in the size of the body of the lumbar vertebrae, that is the fifth lumbar vertebrae. Okay, so this lumbosacral angle will have some very important in analyzing the functioning of the lumbar spine as well as the lumbosacral junction. Okay, and normally the angle, the creation of the sharp lumbosacral angle, and it is 120 degrees in an adult. So there are many kinds of measurements are there, but this is the degree they have given normally in the Chaurasia textbook, but there are some other calculations are seen that we can see in the next year. Okay, now, so this is about one feature, and the pedicles here are directed backwards and laterally. Here the pedicles are directed backwards and laterally, whereas in the remaining one they are directed backwards and medially. Here the pedicles are directed backwards and laterally. Okay, the superior articular facets look more backwards than medially. So the superior articular facets are facing more backwards than medially, and the inferior articular facet look more forward than laterally as compared to the other lumbar vertebrae. So these are all the distinguishing features of the fifth lumbar vertebrae with that of the typical lumbar vertebrae. Okay, now we will see the attachments of the lumbar vertebrae in the next session. Thank you.